Yeah, I texted Melissa and
You didn't text me!
Holly
And I'm the only one that really counts, Jill.
and
You'll be shocked how many times I've talked to a patient and they told me the medication that they're taking. Lithium, Depakote, Laurel, lamotrigine, so on and so forth. But they can't tell me what their diagnosis is. They'll say, oh, I think I'm depressed, maybe I'm anxious, I don't know. They never told me what I have. It appears as if providers are not telling patients what diagnosis they have. And I get it, in the inpatient hospital, sometimes you won't tell the patient the diagnosis right off the bat. Let's say somebody comes in and they're manic and they're agitated. They're not able to understand anything because they haven't slept in 7 days, in 14 days, in 3 weeks. Okay, after they sleep for a couple of days, then you can let them know that they have bipolar disorder, schizoaffective, schizophrenia, whatever the case may be. But a lot of people don't know what they're diagnosed with. And that baffles my mind because the diagnosis is the most important initial step. So every appointment that you have with your psychiatric provider is important. But if you screw up on the first one, which is the psychiatric evaluation, as a provider, you've messed up. Because if we don't nail the diagnosis, then how do we know the treatment? There's a lot of people out here who are taking mood stabilizers, people who are taking antipsychotics, people who are taking medications that if you Google or you put these meds through Reddit, it will say that we use these things for bipolar disorder. And it's not the most reliable method to have to go to Reddit or Google or some forum online to figure out why you're taking your medications. Your provider should tell you these things. And I get people being confused when they're misdiagnosed with depression, because that's normally how you see things. Somebody comes to the office, they're at a low, and the provider is not able to get enough collateral information from family members and caregivers and spouses. So they see somebody who's at a low, and they did a questionnaire, and they say, oh, the person's depressed. We'll give them Prozac, we'll give them an antidepressant and see where we go from there. Person goes home, they take the medication, they get too energetic, they become manic. And then when they go back to the clinic, the provider is like, oh, okay, all right, I see what happened. We push this person into a hypomanic episode. We push them into a manic episode. We gotta either take the med away or introduce a mood stabilizer. Introduce your Depakotes, your lamotrigines, lithium, Zyprexa, whatever you do, but you don't tell the patient that you think that they have a form of bipolar disorder. And sometimes providers, we don't know what the diagnosis is. And a lot of times when we don't know, we'll leave it as unspecified mood disorder. But I believe that you should be telling your patients these things. And one of my favorite things to say in my career is, I don't know. It's so liberating. I don't know. I think you could have bipolar 2 disorder, but I don't know, because it looks like depression and anxiety. I think you have bipolar 1 disorder because these things that have been happening, along with your history of impaired sleep and the voices that you hear when you're manic. I think you may have bipolar 1 disorder, but I'm not sure. We should be saying, I don't know, a lot more. And if my provider tells me that they don't know, I feel more confident. They're not just saying, oh, you have this or you have that. But we should walk our patients step by step through the diagnostic process, so that way they know what you believe that they have, so they can advocate for themselves. It's like I should teach a class on this or something.